Hey, it's Dr. Anderson here at Advanced Foot and Ankle in Bountiful, Utah. We thought we would just spend a couple minutes today talking about one of the treatments that we've had a lot of success here with patients that come into the office complaining about painful heels. Particularly women, we'll see throughout the year patients will come in complaining about dry, cracking heels. They'll get fissures in the heels that bleed. This can be particularly dangerous in people that have diabetes, because it can cause a bleeding sore that can get infected and turn into an ulcer. One thing that we found that works really well when we see these dry, cracked heels that cause heel pain is Pedinol has made this really great kit that basically has a couple steps. It comes with an exfoliating soap. So basically we'll have let me go back to the start. We'll actually have the patient begin with this Sleep and Heal sleeve. This sleeve is it has a silicone lining on the inside. It's like a sock that you can put on your heels while you sleep at night. Usually we'll have women, prior to doing this, put some of this urea cream on their heels. It's 20% urea, which is a very potent cream that eats away callus tissue, all that thick skin you get on your heel. If you put this lotion on, it's going to really penetrate in the skin and soften it up. The exfoliating soap helps to get a lot of that skin to slough off afterwards. But typically, what we found works well is to put the lotion on, put the sleeve on at nighttime, and sleep each night with this. And usually after a week, you'll see some dramatic improvement with that dry, cracking skin. Some women will find don't like to wear a sock at night. Before we had this sleeve kit, we've used this Revitaderm for several years. There used to be a prescription for a 40% urea-based cream that we would send people to get. Very expensive, even with insurance coverage. The copay was very expensive. We found a lab in California that makes this Revitaderm. It's a 40% urea-based cream that you put on your heel or up on the balls of your feet, wherever the dry, cracked skin is, and you leave it on overnight. Some people find it works well to put it on, put a sock on. You could use this in combination with the Pedinol sock or sleeve to wear at night. But you put a good layer of this on the calloused areas. And in the morning time when you bathe, you use this pumice stone to file away all the dead skin. And again, this urea lotion penetrates really deeply into the skin, softens it up, and it will come off in layers. So we've seen some really dramatic improvements where women come in with these dry, cracked heels they've suffered with for a long time. They'll use this cream for even a week, and we'll see some really dramatic improvements. So for painful, dry, cracked heels, for fissures in diabetics, or for women to just get generalized calluses and thick corns that develop to the balls of their feet and back to their heels, Revitaderm 40% urea lotion we have here at the office, and we'll usually prescribe that. Works fantastic. One other cream that I want to talk about, we see a lot of people that also, particularly with diabetes, they'll get dry, cracked legs. They'll get that brown discoloration. When you have swelling in your lower legs because of varicose veins and poor circulation, this Amerigel Blue is a lotion or a cream that's been formulated specifically to apply to the legs and the feet. It moisturizes, really softens up, and it actually penetrates into the leg area where people have that dry, cracking skin. Calms the inflammation down and helps the discoloration to improve, as well as the skin to become more supple so you don't get those sores that are associated with the poor circulation in your legs. So the Amerigel Blue, great lotion. We have people that come back consistently and want to use this because it's worked so well for them. So those are a couple lotions and creams we've had success with. If you have any further questions or information, please call us or make an appointment and come see us. Again, we're here in Bountiful at Advanced Foot and Ankle. We also have an office in Draper in Salt Lake City. Thanks.